So today we're going to finish talking about the reproductive system. So the ovarian cycle, the learning outcomes are to list the stages of the ovarian cycle and explain what is occurring in each stage, describe the process of oogenesis, and summarize how estrogen and progesterone influence the ovarian cycle. So the ovarian cycle for non-pregnant, the oocyte or the immature egg is contained within a follicle. Females are born with 2 million follicles, but have only 300,000 to 400,000 by puberty. Only 400 ever mature. A female produces only 1 egg per month during her reproductive years. As the follicle matures during the ovarian cycle, it changes from a primary to a secondary to vesicular follicle. Okay, so the ovarian cycle, a primary follicle contains an oocyte and begins producing the sex hormone estrogen. The secondary follicle contains a secondary oocyte and produces the sex hormones estrogen and some progesterone. The vesicular follicle develops. Ovulation, the secondary oocyte is released. The corpus luteum produces the sex hormone progesterone and some estrogen, and then the corpus luteum degenerates. So the primary follicle is epithelial cells surround a primary oocyte. The secondary follicle is a follicular fluid surrounds a secondary oocyte. In the vesicular follicle, the fluid-filled cavity enlarges to the point that the follicle wall balloons out on the surface of the ovary. So oogenesis is the production of an oocyte. A primary oocyte undergoes meiosis I. The 2 resulting cells are haploid. One of these cells is called the polar body. Its function is simply to hold discarded chromosomes. The secondary oocyte undergoes meiosis II, but only if it is first fertilized by a sperm cell. So ovulation, the vesicular follicle bursts, releasing the oocyte. The vesicular follicle then develops into a corpus luteum, a gland-like structure. If the egg is not fertilized, the corpus luteum disintegrates. A primary follicle produces estrogen, and the secondary follicle produces estrogen and some progesterone. The corpus luteum produces progesterone and some estrogen. So like in males, the hypothalamus secretes GnRH. GnRH stimulates the anterior pituitary to produce FSH and LH. These hormones control the ovarian cycle. So phases of the ovarian cycle, we have the follicular phase, the first half of the cycle. FSH promotes the development of primary follicles, which primarily secrete estrogen. A surge of LH is released from the anterior pituitary, triggering ovulation on day 14 of a 28-day cycle. We have luteal phase. LH promotes the development of the corpus luteum, which secretes high levels of progesterone and some estrogen. If pregnancy does not occur, it regresses and a new cycle begins. So estrogen and progesterone responsible for the secondary sex characteristics, axillary and pubic hair, greater fat accumulation under the skin. Both estrogen and progesterone are also required for breast development. So menopause is when the ovarian cycle ceases, usually between ages 45 and 55. The ovaries no longer respond to gonadotropic hormones, and they no longer secrete estrogen or progesterone. At the onset of menopause, menstruation becomes irregular, but is not complete until menstruation is absent for 1 year. So the uterine cycle is a cyclic series of events caused by estrogen and progesterone. 28-day cycles are divided as follows. Day 1 to 5, menstruation, low levels of estrogen and progesterone cause the endometrium to disintegrate and its blood vessels to rupture. So menses is the flow of blood and tissues out of the vagina. Day 6 to 13 is the proliferative phase. Increased production of estrogen by a new follicle causes the endometrium to thicken and become glandular. And on day 14, you have ovulation. Day 15 to 28 is the secretory phase, which increased production of progesterone by the corpus luteum causes the endometrium to thicken. It also causes the uterine glands to mature and produce a thick secretion. The endometrium is now prepared to receive the developing embryo. If this does not occur, the corpus luteum regresses. The resulting low level of progesterone causes menstruation. Again, that's summarized here. So fertilization and pregnancy. Only one sperm is needed to fertilize the egg, which is then called a zygote. As the zygote travels down the uterine tube to the uterus, it begins mitosis. Once it is made of many cells, it is called an embryo. So the placenta sustains a developing embryo, originates from both maternal and fetal tissues, where exchanges between fetal and maternal blood occurs, and produces human chorionic gonadotropin, or HCG, which maintains the corpus luteum. A pregnancy test detects HCG in the blood or urine. So rising amounts of HCG stimulate the corpus luteum to produce increasing amounts of progesterone. Progesterone shuts down the hypothalamus and anterior pituitary, so no new follicles begin to develop. The progesterone maintains the uterine lining, where the embryo now resides, preventing menstruation. So birth control pills to prevent pregnancy usually involve taking active pills and inactive pills. The uterine lining builds up while the active pills are being taken. Progesterone decreases after the last active pills are taken, causing menstruation. So control of reproduction. You learn the outcomes are to list the forms of birth control and summarize how each reduces the chances of fertilization of an egg by a sperm cell. Explain the causes of infertility. Describe how the use of assisted reproductive technologies can increase the chances of conceiving a child. So there's contraceptives, which are medications and devices that reduce the chance of pregnancy. Birth control pills, the most effective form of contraception, can also administer hormones through a patch applied to the skin. This also shuts down the pituitary production of both FSH and LH, and ovulation does not occur. So contraceptive injections and vaccines. A vaccine is in development that immunizes women against HCG, the hormone necessary to maintain implantation of the embryo. Contraceptive implants use synthetic progesterone to prevent ovulation. So the length of time between injections is a few months. So surgical methods of vasectomy, cutting and sealing the vas deferens from each testes. The amount of ejaculate remains normal. Sperm make up only 1% of the volume of semen. Testosterone is still produced normally. A tubal ligation is the cutting and sealing of the uterine tubes. So causes of infertility. The uterine tubes can be blocked from pelvic inflammatory disease or endometriosis, the presence of uterine tissue outside the uterus. This tissue goes through the usual uterine cycle, causing pain and makes it more difficult to conceive. So assisted reproductive technologies, in vitro fertilization, conception occurs in laboratory glassware. After about 2 to 4 days, the embryos are transferred to the uterus. If desired, the embryos can be tested for a genetic disease before implantation. Intracytoplasmic sperm injection. The sperm is injected into an egg. So assisted reproductive technologies. So we have gamete intrafallopian transfer, or a GIFT, the same as in vitro fertilization, except the eggs and sperm are placed in the uterine tubes immediately after they have been brought together. Surrogate mothers, women are contracted and paid to have babies. Sperm and or egg can be contributed to the parents. Okay, so sexually transmitted diseases. Your learning outcomes are to distinguish between sexually transmitted diseases caused by viruses and those caused by bacteria, and describe the causes and treatments of selected STDs. So STDs caused by viruses. Treatment is available but cannot eliminate the virus from the body. Drugs can merely slow replication of the viruses, thus they are not curable. Antiviral drugs have serious debilitating side effects. HIV infections. So HIV causes AIDS. There is no vaccine to prevent an HIV infection, nor is there a cure for AIDS. Infects helper T cells, which stimulate an immune response. HIV impairs the immune system. During the first stage of an HIV infection, symptoms are few. but the individual is highly contagious. So several months to several years after infection, the helper T lymphocyte count falls. Opportunistic infections begin to appear. So highly active antiretroviral therapy is usually able to stop the reproduction of HIV to the extent that the virus becomes undetectable in the blood. But as soon as AART is discontinued, the virus rebounds. So genital warts are caused by the human papillomavirus, or HPV. Warts are often on the penis and foreskin of men and near the vaginal opening in women. There is a vaccine for HPV. Genital warts and HPV are associated with cancer of the cervix, vulva, vagina, anus, and penis. So genital herpes are caused by the herpes simplex virus. Type 1 usually causes cold sore. Type 2 causes genital herpes. The blisters may be accompanied by fever, pain, or urination, swollen lymph nodes in the groin, and in women, a copious discharge. So hepatitis infects the liver and can lead to liver failure, liver cancer, and death. 6 viruses cause hepatitis, designated A, B, C, D, E, and G. Hepatitis A, usually acquired from sewage-contaminated drinking water, but can also be sexually transmitted through oral anal contact. Hepatitis B is spread through sexual contact and by blood-borne transmission, so accidental needle stick, contaminated blood transfusion, sharing infected needles, or from mother to fetus. So STDs caused by bacteria are curable with antibiotics. Antibiotic resistance in these bacteria may require intensive treatment to achieve a cure. So chlamydia is usually mild or asymptomatic in women. 18 to 21 days after infection, men may experience a burning sensation on urination and a mucoid discharge. Women may have a vaginal discharge. Also causes cervical ulcerations, which increase the risk of acquiring HIV, can cause pelvic inflammatory disease. So gonorrhea, males often have a pain upon urination and a thick greenish yellow urethral discharge. Females can get PID. If a baby is exposed during birth, an eye infection leading to blindness can result, can spread to internal parts of the body, causing heart damage or arthritis. So syphilis has 3 stages, often separated by latent periods. There's the primary stage, where a hard sore at the site of infection, a secondary stage where a rash that does not itch, a tertiary stage lasts until the patient dies. May affect the cardiovascular system, the nervous system, and gumas, or large destructive ulcers, may develop on the skin or within internal organs. So congenital syphilis is caused by syphilitic bacteria crossing the placenta. The child is born blind or with numerous anatomical malformations. So vaginal infections, vaginitis, any vaginal infection or inflammation. Bacterial vaginosis can be sexually transmitted. Symptoms are vaginal discharge with a strong odor, burning during urination, itching or pain in the vulva. Douching increases the incidence of BV. Vaginal infections continued. A yeast and a proteazoan are 2 other causes of vaginitis. A yeast infection causes a thick white vaginal discharge. Trichomoniasis is caused by the protozoan. The urethra is usually the site of infection in males. Females get a foul-smelling yellow-green frothy discharge and itching of the vulva and vagina. And this greatly increases the risk of infection by HIV. Okay, so that's the end of the lecture there.